Good afternoon, everyone. My signature assignment is on osteomyelitis. We're going to be discussing the etiology, demographics, the anatomy, physiology, symptoms, diagnosis, treatments, and AI models involved in the treatment and diagnosis of osteomyelitis. So, a brief introduction into what osteomyelitis is. Osteomyelitis is an infection of the bone caused by pathogenic microorganisms. Here we have an illustration of what it looks like when it occurs in the vertebra. So, essentially, osteomyelitis um, enters through the bloodstream, right? The infection occurs through there, settles within the bone, and it's typically caused by Staphylococcus aureus, and it predominantly occurs following a traumatic fracture. Some environmental risk factors include poor hygiene, contaminated wounds, and unsanitary conditions. Genetic risk factors for osteomyelitis can include blood disorders, inherited bone disorders, and even some immune system deficiencies. Some behavioral risk factors are tobacco use, substance use, poor hygiene practices, and malnutrition. Here below we have an image of what it looks like when they detect osteomyelitis in medical imaging. Medical imaging is essential in early detection, and there are machine learning techniques which are essential in detecting osteomyelitis in its infancy stages. The demographics that are most likely to develop and acquire osteomyelitis are adults over the age of 50, adults living in developing nations, drug abusers, intravenous drug abusers specifically, and people with diabetes. So the incidence rate of osteomyelitis is 90 per every 100,000. In the US, it's 2 to 5 cases per 10,000. And in some countries, such as Norway, their incidence rate of osteomyelitis in children is about 10 to 14 cases per every 100,000 children. So, in children specifically, the long bones are typically the most affected bones in the body and the most vulnerable to developing osteomyelitis. So, in adults, the hip bone, the feet, and the spinal cord are the most affected by osteomyelitis if the infection occurs. Infection usually begins within local blood vessels to a bone, causing necrosis of a region of the bone. It can then spread to the cortex and the periosteum. This is an image illustrating just that. So, physiology and symptoms. So, it's prevalent that osteomyelitis is present in the body when a person spikes a fever, has yellow purulent secretions, is experiencing chronic back pain and bone pain. And if it goes untreated, it can cause bone death, um, a surplus of abscesses, stunted growth, and even sepsis, which can then ultimately result in death. And this is an image illustrating just how it occurs in its infancy stage to a more developed stage. Osteomyelitis has a mortality rate of 1 in every 5 people. It actually has a high success rate if treated of 96.2% with a 12-month follow-up. And this is a chart of all the bones that could be potentially affected and the rate at which each bone is affected. So as you can see here, the tibia is the most affected by osteomyelitis. Diagnosis, treatment, and artificial intelligence. So imaging tests, blood tests, bone scans, and biopsies are the usual method that osteomyelitis is diagnosed. Treatments available include antibiotics, needle aspiration, NSAIDs, and surgery, surgical interventions. And here you can see an image of osteomyelitis and what they would see in an x-ray. So despite all the treatments and surgical interventions available, reoccurrence rate is high with a percentage of 20 to 30%. Currently, there are no AI models uh, available in the treatment of osteomyelitis, but there is AI models available to help early detect osteomyelitis. And here we have a chart showing all the different treatments that are available to people with osteomyelitis. And this is my list of references and where I got all my information, and that's it.